today with Miss Egan and Miss Watts to talk about the problem that is facing us today with prescription drugs in schools, with teens, and all around. First, tell us about your role at Rosecrans.
Hi, yes, I've been with Rosecrans a little over 6 years, and I came to Rosecrans because previously I worked in a school and worked with, just like this, teens and substance issues, and it's really my passion to work with kids and families and to help them make healthy decisions and live good lives.
And I have been with Rosecrans going on 2 years, community relations coordinator, and I work a lot with the high schools and colleges and universities in your area, North Cook and Lake, and I'm also an outreach counselor, so I do substance abuse evaluations many times for teenagers, but adults as well.
How did you get started with this? Is there a story behind why you chose to do what you do?
Well, my job is to work in our satellite offices, and Rosecrans has our main facilities in Rockford, and we have a substance abuse treatment program, rehab. And so one of the things, of course, is that teens never want to come to treatment, right? Mm-hmm. And because there's all kinds of misperceptions about what that means and what that is. And so one of the things that we have in our offices in the Chicago area is that we can meet with individuals and families and provide them with some direction and guidance and, do some counseling with teens if they are appropriate for treatment services.
Okay, so prescription drugs are everywhere, on counters at the store, at shelves in our own homes. In your opinion, should prescription drugs become harder to obtain?
Well, I think what has happened with the prescription drug problem in our society today is that doctors, prescription drugs are prescribed by doctors, so technically they're really not available unless you consult a doctor and who has medical training and giving them to you, prescribing them for medical conditions. So I think what's happened is doctors are trying to prevent people from having pain or discomfort, and our society has sort of bought into that notion that there should be a pill or something to take away an uncomfortable state. And what has happened, unfortunately, is that, the classic example is that, you go and have dental surgery and you get a prescription for Vicodin, and then you have, a 30-day prescription and you have 2 refills, and maybe you only need 2 or 3 pills at that. So what that then happens is that, there are lots of leftover medications around, and then that presents all kinds of problems, with excess drugs being available.
When did prescription pills become an issue amongst younger students? When did you first see that change?
It was about 3-4 years ago we started to see the rates going up for teenagers. I think one of the things, again, is that doctors were prescribing, and we've seen teens who have come to us who maybe have had a sports injury, for example, and were prescribed, a pain pill. And what has happened then, they'll be using that and taking that maybe without the best guidance or direction or understanding on what are the effects or side effects are, and would start using it, maybe like it, become addicted or dependent on it, and then turn to getting those pills on the street. The other thing is that, as I mentioned earlier, if somebody has excess prescription drugs in their medicine cabinet, it might just be a temptation to use or to try, and that's what's happened with teenagers.
Okay, and about these drugs, there's also a lot of different kinds of drugs that people use, like Xanax, Adderall, all the other drugs that you see used in high schools and colleges. Why do you think students use these drugs? Why do you think they get into it?
I think teens are really, in some ways, no different than adults in that drugs are used to deal with uncomfortable feelings or situations or people, and it takes away, it's an altered state that takes away that pain or discomfort, whether that's physical pain or emotional pain, and it gives you that different state of being. And so, for example, Adderall might provide that stimulation to be able to stay up all night and study for a test, or Xanax to take away the anxiety or the stressful feelings associated with your life or a specific situation, or relief of pain.
From all the drugs that you have worked with, which one do you think has had the most effect on the younger population?
I think we see more teens using prescription pain pills. There is a connection with the heroin use and crisis that we see going on right now. Sometimes people have started, again, like I mentioned, maybe a sports injury, they've used Vicodin and they've become dependent and then can't get it from their doctor and then move to a similar class of drug which is illegal, like heroin. The stimulant pills like Adderall, for example, we see kids and teens and college students using that and experimenting with that too. Probably not to the same level of abuse as pain pills. Pills like Xanax, I think, are used, in tandem with other drugs, and that's an issue. But I would say the pain pills, like Vicodin, are the main drugs of abuse for teens.
So the classes of drugs that we're talking about are painkillers, depressants, and stimulants. Out of those three classes, which do you think are the most dangerous and have the most detrimental health effects on us?
Well, one of the things that we've been seeing a lot of are the use of painkillers and the transition into heroin. And one of the things that we know is that the withdrawal from those drugs is very, very uncomfortable and painful. Causes vomiting and diarrhea and bone aches and sweating. It's like the worst case of flu that you have in your life. It is not life-threatening. It's one of the things you feel like you want to die, but chances are you're not. So in regards to your question, I think some people, that would be a very strong effect. In treatment, we know that the people going through withdrawal from alcohol and Xanax are the ones that have the most serious life-threatening effects.
Which of these drugs are addictive? Is it all of them, or are certain ones more addictive than others?
The most addictive, as we've talked about, would be in the opiate-based, the painkiller classes, just because that is a more addictive chemical component than the antidepressants, not so addictive. So that's usually something that many teens are legitimately prescribed, antidepressants, whereas the opiate-based prescriptions are far more commonly abused by teenagers.
So, what treatments and programs does Rosecrans offer its patients to help rehabilitate them?
Rosecrans offers many levels of care and assistance, from a prevention, early intervention program where if somebody maybe experimented or used, and found out that there are consequences, but without there being a pattern or a regular pattern of use. And so we offer a prevention program, we offer outpatient programs. So if somebody is starting to abuse a drug or alcohol, there's a outpatient program in Northbrook for teens, and that offers an opportunity to come after school a couple times a week and to meet with a counselor and to get your life back on track without really disrupting your life, too much. And then, of course, the higher level is residential treatment where a teen would come to treatment at Rosecrans for 35 to 45 days and go to school and work on their life in a sense of living without the drugs and alcohol and learning coping skills to live their life without using those substances. Solutions for people using drugs is I think sometimes there's stigma, shame, ignorance about substance abuse, addiction, treatment. So I think the more that people understand that addiction is a chronic brain disease, doesn't mean that you're a bad person or less than person. It means that there's this brain disease, and I think we need to come further as a society to understand what that means and what it also means for treatment. Treatment is very effective. there are over 20 million people in the United States in recovery, living in recovery from addiction. So treatment works, recovery is possible, and I guess the message that I would like to convey is that the sooner somebody recognizes that they have a problem or an issue with drugs, and the sooner they can get help, the better off their life will be.
How has the media played a role in students starting to do these drugs?
I would say that the media has opened up just a wealth of information. So teenagers at a much younger age are able to explore the internet and find out what drugs are out there, what they do. There's drug websites that they can go on. Just all the information is sort of at their hands, as well as accessing actual drugs through the internet, which is something you certainly didn't used to be able to do. So media, and then pictures and movies and all of that, a lot more using, and just less, I don't know, kind of a conservative nature about drug use. It's sort of all out there for them to see and to learn. Same with in Facebook, all of that, just even communicating about drug use and being able how to access it. All of that information is being exchanged.
I agree. If someone were to get caught selling drugs, what would be the consequences?
The consequences for selling drugs could go anywhere from, you said you didn't know this. Why am I going to know this? Yeah, obviously you can get arrested. All right, let's.
Consequences for using drugs with
Selling drugs.
for selling drugs.
Yeah.
With law enforcement, obviously you can be arrested. Our jails are filled with people who are in jail for using drugs. It's loss of life, of potential. Instead of something more productive. We're not law enforcement, so unfortunately we don't understand, or not understand, but unfortunately we're not law enforcement, so that's not our area of expertise.
What you have seen, is it the same for adults and minors? Do convicts sometimes receive rehabilitation instead of a punishment? Instead of going to jail, would they be sent to Rosecrans?
Yeah, sometimes we have people coming to treatment both at our adolescent facility and adult facility who are on probation or have been through drug court, which drug court emphasizes treatment versus jail time. And if somebody cooperates with that and gets treatment, obviously if somebody is able to rehabilitate their life and to be a fully functioning member of society, that's the goal. So that does happen.
Have you ever worked with someone at Rosecrans who was a patient who was directed to you via the court system?
Yeah, all the time, yes. I have, I'm sure Sarah has too, who've been on probation, and they have a probation officer monitoring their behavior and activities because of some incident, and so the probation officer checks with them about school and home and will give drug tests, and so they will refer those clients to us and take a look if treatment would be an option for those people.
Going back to the rehabilitation process when it comes to prescriptions pills, what does it look like? What is the standard day for one of these patients?
In residential treatment?
In residential.
Well, teens get up in the morning around 7 o'clock and, get dressed, have a meditation, have breakfast. They'll go to school while they're in treatment for 4 hours. So they're working on their academic classes, participate in the school part of the day and some kind of physical education. Rosecrans provides therapeutic recreation. There's also art therapy, horticulture therapy, and so that is built into the day. Obviously, for teens, the worst idea in the world would be to sit around and doing counseling all day. So there's lots of activities to make it fun and to learn how to live a life in a fun way without drugs or alcohol. The afternoons generally are filled with group counseling, individual counseling, working on individual treatment work. And again, Rosecrans is blessed to have a beautiful facility on 50 acres surrounded by a Japanese healing garden. So there's opportunities to go outside, play therapeutic games or games with family or group members. So lots of opportunities, and and then a teen would go to bed around 10:30, 11 o'clock at night.
What period of time is average for the average patient dealing with prescription pill abuse? What is the average time that they would stay in a rehabilitation center?
Rosecrans, it's about 35 to 45 days. It's an individualized treatment plan, so depending on what's going on with the individual, some might be shorter, some longer. Some teens have what we call co-occurring disorders, so their drug use might come along with depression or anxiety or trauma, and so that would be part of treatment. I forgot what the question was.
Is the withdrawal and rehabilitation process different for each type of drug? Once again, these are the groups: painkillers, depressants, and stimulants.
There are differences with withdrawal, which we stated earlier. Treatment is the same. What we try to get at in treatment is what's the motivation behind using drugs? What does it do to help you or to help you cope in your life? And maybe there's other ways to cope with those issues of depression or traumatic experiences or anxiety and those kinds of things instead of using a drug.
In your opinion, what is the most important misconception that young people have when it comes to prescription pill use?
I think what I have heard is that many teens say, if I know it's a problem, I would stop. And so I think that is a misperception, that there's some type of control, and the definition of addiction is loss of control and having adverse consequences as a result of your use but not being able to stop. And so many times teens come in who I've met with, and they'll say, well, I'll know when it's a problem, and that's the hallmark of addiction. So that's what I would say.
I think the greatest misconception is that with prescription drugs, teenagers many times may think that they're not addictive or that they're not susceptible to the addiction because they're legal, prescribed to someone in a legal way, but any time that you're using someone else's prescription, you're at least misusing it, if not abusing it, and you can easily become dependent upon it, especially with the opiate-based prescriptions that we talked about earlier. So I do think that's the most common misconception, is that they're not necessarily addictive.
People say all the time that it's medicine, and they don't understand. I know we've both worked with people and people we know who haven't really understood the power of that drug and what could happen, and there is that potential for dependency and addiction. So education is certainly important, like shows like this that we're talking about today.
Okay, thank you so much for your time. We're here once again with Miss Egan and Miss Watts, coming from you from the East Lyton Talent. Thank you.